Welcome to Coffee Chat with Anastasia. This event was filmed live at the California Dental Association and it's brought to us by Crest and Oral-B. I have an amazing panel of guests, Dr. Chris Salerno, Pam Hughes, and Debbie Z. Together, they are here to empower you, the dental hygienist, which ultimately helps us empower our patients. I do believe that together we can take what we learn and make a difference with it.
Film, though, there's so many art forms that come together to make a good or bad movie, right? You have the screenwriting, the lighting, the cinematography, the editing. So you can have a great actor in a terrible movie. I would love to be a director because I think you, as a director, have the greatest chance to have some creative control, to get everyone on this vision for this project, get your team approach together.
I heard the word control. I didn't hear anything else past that.
Right. Right.
Hygienist in the house, come on. Okay.
Yeah.
Yeah, okay, sorry.
You're absolutely right. Yeah, good call.
I got you. I do like the fact when you said, though, as far as directing, and I know, I mean, as far as when you're talking about, like, people have to be on a spot or an X, or, you know, you have to make sure you say the line, or there's a script or something like that. And many of us have heard or had practice management consultants come through and share with us, okay, this might be a better word than this. You know, like, for example, my word is wellness. I do not, and it's one of the things the question will be for hygiene, you know, Hygiene Proud, is the fact that it's not a cleaning. And I get bashed. We've talked about this a bazillion times, but it's not a cleaning. We always hear it's cleaning, and people will say, Anastasia, please, that you're never going to change anything. Let me just tell you this. Okay, so you see, I'm going to use this. I'm going to use your black coffee as an example. Starbucks came out in what, the 90s? You remember when they came out and they said, we got tall, grande, and venti. Remember that? And you go to order something, and what did they say? Anastasia, you're more than happy to get your grande, you know, and they stated whatever it was I ordered. So what if you switched it and you said wellness visits? Isn't it about wellness? And when you said that, you're the director.
Right.
So that would be, I mean, I just think of you directing your team with that. That would be just, you know, kind of cool. Because if you hashtag wellness and you hashtag dental cleaning, I can promise you wellness will have so many more really cool things that connect to our mouth. So it's just a thought, but if Starbucks can do it, I can't wait.
Yeah, you can draw analogies. I like that. You know, the team approach in your office is like what I was talking about with films, right? So
yeah.
You know, that analogy works in a couple places. One goal, like your goal is to make a great movie. One goal is to have a successful practice, right? So that certainly, with dental economics, I'm the editor for that. We talk about practice management and how to have a successful practice. But where it also works is if the goal is an individual patient's oral health. Right. So in the case of practice management, running a successful business, we know that on that team, the hygienist is a critical member. Ask a Dr. Roger Levin, ask any practice consultant, they'll tell you if the hygiene department isn't happy, ain't nobody happy. Your practice is not going to be doing very well if you have an unhappy.
I've heard
it's true. Absolutely true.
Could you please share some things that you have done in your office to include the hygienist? Because many times too, I'll be working on something and I'm like, I have no idea what just happened, like with as far as implants.
Well, so I lectured at RDH Under One Roof a few years ago on this subject, and I started my conversation. I started the presentation with an apology. So I'm going to apologize to you right now too. Okay? On behalf of dentists everywhere, and there's some other dentists in the office, they'll be nodding their heads in a moment too. On behalf of dentists anywhere, we're sorry. I know for like a lot of things, but we're really sorry because we have ignored implant hygiene for so long. We have, right? We were absolutely. We need to do a better job about that. Whenever I have an implant case, before the implant restoration, whatever it is, a single unit, a whole, full arch, whatever, I show this to the hygienist. I say, this is what this is going to look like. Let's now see underneath, you know, it may look like a tooth above the gums, but beneath the surface, there can be all kinds of nooks and crannies that are food traps and nituses for plaque, right? So let's look at this together so we can plan what we need. Let's assess what this patient is going to need moving forward for their hygiene needs.
How would you recommend somebody here say, okay, because you start with the hygienist, you say, I believe you take the hygienist into your room and you share with them, and that's brilliant. So that way they can understand and recommend, but the patient needs to be on the same team too.
So what I recommend, first of all, let's look at their risk profile. Is this someone that lost an individual, one tooth for some freak reason, an endo failed or whatever, and their hygiene overall is actually really good? That is a low risk patient, right? On the high risk side, we would have things like someone who was completely edentulated because of their lack of interest in home care, severe perio disease, whatever you want to call it. And now they have this full arch prosthesis that's fixed in their mouths that is impossible to clean. How do we think that's going to work out for them? Right? So that's on the high risk side. And then there's everything in between. So first let's assess risk, but then let's put together a program for that patient. Now, regardless of what their risk is, but certainly the more severe, as the severity of the risk goes up, we need to recommend a home care regimen for them that's going to work. We know that the power brush that Oral-B has, the oscillating and rotating technology, we know that's the best for removing plaque. So we're going to start there. What I really love, though, are the brushes that have the Bluetooth feature and the app. Have you guys been working with your patients on this? It's awesome. Because not only is it collecting great data, you're using too much pressure and how long you're brushing for and all of that great stuff, but it's an excellent patient motivator.
Yes.
And especially as we get more severe in the patient, as a difficult case for a patient to keep these prostheses clean, the more severe it gets, chances are this is someone who needs to turn over a new leaf with their hygiene, right? So we need to throw everything we can at this person to motivate them.
If I'm going back to my practice on Monday and hearing what you said, that I feel it's really important hygienists need to see what type of implants your doctor is doing, or show me what would be good to get around that particular implant, how do I start that conversation with my doctor?
Find out, have a conversation with them what their level of implant expertise is. Now, I realize that may be an uncomfortable and awkward conversation, but unfortunately there are I'm a general dentist, there are a lot of general dentists out there restoring implants who have, well, let's be polite, have varying levels of education about how to do this a certain way, okay? So to talk to them about, hey, think about a recent case that concerned them. If you were to go up to your dentist and say, this patient's implant is bleeding, what should we do? What would their response to that be? Would they say, oh my gosh, send him to the periodontist, I don't know what's happening, maybe the implant's down? Well, we know that just could be a peri-implant mucositis. That's very treatable in the general dentist practice. You can treat that if he or she is arming you with the correct armamentarium to do that in the office. So assess, just like you assess with your patients, assess what your dentist's level of education is with implants. If it's low, you may need to really steer this ship, and I urge you to do that. Have a conversation with them about how this is going to be a wonderful service to provide for patients. Take control of that. If there's someone that they're busy doing their procedures in their other room and they leave all of the hygiene to you, perfect. You can handle all of these things yourself with the home care products that you can recommend and with the in-office products.
Thank you for your time.
Thank you very much.
Yes, are you kidding? That's awesome.